Can you tell me what brought you into my office?
About a year ago, I was having severe headaches. The headaches were going on for about a week before I contacted you. Finally, it was a Sunday morning, and I just couldn't take it anymore, and I resisted calling anybody or doing anything to disturb anybody on a weekend morning. So I called you first, actually, knowing your expertise, and you said, Kenny, this sounds serious, and I described to you what was happening, that my headaches were spontaneous, no history of anything like this ever before, even remotely. It wasn't provoked by anything I could tell, although I was pretty stressed out at the time, going through some transitions in my dental office, the stresses of COVID and running the practice and things like that, but nothing that I could physically associate with headache starting. Based on what you're telling me, you need to go to the emergency room. That day we went to the Cedars-Sinai emergency room. Not a great place to be in the middle of COVID, actually, but that's how bad it was, that I was willing to take that risk and go into to be triaged there, because it was just so horrible. It was really, really terrible. In fact, if you remember when I first came to see you at your office, you had thought that I looked like the painting, the Scream, with the holding the face and everything, and that's how I felt, actually. I could tell that this was not your first rodeo with this. The pain was so excruciating and so exquisitive that I could even just brush up on my hair, and it was painful. So something that shouldn't have been painful was painful. First appointment in the back of my head, in the occipital region. We did in this area here. We did masseters. When I walked out of the office, my feeling was that I kind of knew how my patients feel when they walk out and they say, they were numb, and my head was numb. After the first visit, maybe the left side was maybe a 2 out of 10 on a pain scale. The right side was still maybe a 6 or a 7. After the second visit, doing the working on the right side, it was probably down to maybe a 3. But it wasn't completely shut down yet. But it was really close, and it was really to the point where I could function. I was able to sleep again and stuff, and my appetite was fine. So I knew we were going in the right direction. And then finally, we had decided that a third visit would be appropriate. And this time, I think, to me, this was like the sort of the icing on the cake, so to speak, to finish things up. And we decided to use Botox this time. So we focused on, again, the occipital area and the frontal area again. And it was interesting also that going through this and having these pains, that I remembered over the years, even as a kid, even in high school and junior high, that I always had this kind of discomfort or soreness or tenderness in my sternum, actually, also. You were able to elicit that discomfort or that pain that I would have in my sternum, the SCM area. And we said, let's try to shut that down. So we did bilateral on the SCM. 30, 40 years, I would, when I was stressed or something like that, I would feel it here and very tender and painful. Doing that shut it down. And I would say this is about a year later now, 10 months later. In this time, it has been the best it's been since, again, the last 35, 40 years. And I wouldn't have believed it unless it happened to me, unless I actually experienced that. I haven't felt what my even just a minor headache, actually, let alone what my original complaint was. It was amazing. It really helped me and helped me get through a really difficult time, actually. I'm a believer. It works. It absolutely works.
Great. Thank you.